Healthcare costs, the central issue in the federal government shutdown fight. Good evening. I'm Christina DeRobertis.
And I'm Charlie Sakaitis. Welcome to our news at 6. Our top story tonight is the health insurance subsidies that could end unless Congress acts. Millions of Americans who rely on the Affordable Care Act could pay a lot more if enhanced premium subsidies expire at the end of this year. Let's take a look at some examples according to KFF estimates. A single person making $22,000 a year will pay $66 more each month for a typical plan. Around 40% of enrollees who earn between $24,000 and $63,000 will see a rise in bills of $132. And then there's this. Some of it depends on age. If you make $65,000 and you're 27 years old, your bill is going to go up $80. But if you're 60, your bill would go up a staggering $920.
And in Delaware, there are about 50,000 people enrolled in the Affordable Care Act. Coast TV reporter Emma Aiken is in our newsroom. Emma, the Delaware Healthcare Association says this could hurt everyone.
Christina, the Delaware Healthcare Association says if these subsidies expire, healthcare will cost more and hospital wait times will be longer for everyone. The association says the ripple effects will be huge and the move could put a strain on the entire Delaware healthcare system. Carolyn Green says she's scared for her family members who use Obamacare.
That they won't be able to pay their bills completely. And the worry and the stress it puts on them.
Christina Bryan with the Delaware Healthcare Association says thousands of Delawareans could be paying more for health insurance and health care.
This will put a strain on our hospitals. We'll see even longer emergency department wait times. We'll see a strain on our healthcare workforce because they're going to see higher volumes of patients that have more complex needs and worse conditions.
And Brian says a lot of people could be out of health insurance altogether.
If your health insurance costs are going up, that is a big concern that some may choose just to avoid it altogether. And we're just very concerned with the impact that will have on Delawareans' health. If you don't have health coverage, you're probably not going to see your doctor. You're not going to go and get your diabetes managed or go get a mammogram or whatever type of preventative care that you may need.
Again, these subsidies will expire at the end of 2025 unless Congress comes to a compromise. And this all comes after prices for next year's Obamacare health insurance plans became public this week. Christina.
Emma, thank you. And the change you can see depends on where people live, how old they are, and what they earn. Extending the subsidies would cost the federal government around $23 billion next year. That's according to the Congressional Budget Office.